So first we'll be talking about the part Q. Next we'll talk about the heart rate and blood pressure, how to set up the blood pressure and read heart rate. Next we're going to do heart rate and blood pressure at rest. Next we're going to do heart rate and blood pressure during cycling. Finally we do heart rate and blood pressure 5 minutes after cycling. Next we'll interpret the data and make any individualized exercise. So why do we do heart rate and blood pressure? Well, blood pressure is important because the higher your blood pressure is, the higher your risk of health problems in the future. Also, we can find out through your blood pressure if you have hypertension and also hemodynamics. The Part Q identifies medical clearance before fitness testing. It has 7 main questions. 1 yes to the 7 questions require the participant to go to a physician for a physician medical clearance. So in just a moment, we will have Dalison ask the Part Q questions to our patient, Justin.
You're going to answer yes or no. So the first question is, has your doctor ever said that you have a heart condition or high blood pressure?
No.
Question 2, do you feel pain in your chest at rest during your daily activities of living or when you do physical activity?
No.
Alright, next question. Do you lose balance because of dizziness or have you lost consciousness in the last 12 months?
No.
Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure? Are you currently taking prescribed medications for a chronic medical condition?
What does it say in Google? Just say.
Do you currently have or have had within the past 12 months a bone, joint, or soft tissue, muscle, ligament, or tendon problem that could be made worse by becoming more physically active?
No.
Alright, last question. Has your doctor ever said that you should only do medically supervised physical activity? Okay, since you said no to all the questions, you have been cleared for physical activity. Alright, thank you.
Here is a how-to video to get the heart rate from the patient. First, palpate the radial artery that is located on the anterior lateral aspect of the wrist directly above the thumb. Use your index finger and middle finger. Do not use your thumb. Next, start the stopwatch with the pulse of the beat and count the seconds for 15 or 30 seconds. If you count to 30 seconds, then multiply by 2 to get the beats per minute. And if you stop counting at 15 seconds, multiply by 4 to get the beats per minute. Next is a how to set up for blood pressure. Wrap the deflated cuff firmly around the upper arm so that the midline of the cuff is over the brachial artery pulse. Position the cuff so that the lower edge is approximately about 2.5 centimeters above the antibular fossa. Position the stethoscope earpiece so they are angled anteriorly. Place the stethoscope bell over the brachial artery. Close the blood pressure cuff bladder and pump off pressure to about 180 millimeters of mercury. Partially open the valve, slowly release the pressure by 2 to 3 millimeters of mercury per second. Note, when you hear the first sharp thud, this is the first sound of phase 1, corresponding to the systolic blood pressure. Continue reducing the pressure slowly, about 2 to 3 millimeters of mercury a second. Note when the metallic tapping sound becomes muffled. This is phase 4, diastolic pressure. And when the sound disappears, phase 5, diastolic pressure. After noting the phases 4, continue deflating the cuff for at least 10 millimeters of mercury. If no additional sounds are heard, rapidly and completely deflate the cuff. Wait at least 30 seconds, but no more than 1 minute to repeat the measure. If repeats are necessary, average off the 2 measures for the phases 1, 4, and 5 blood pressures. Now we're going to have our patient go on the ergometer bike, and we're going to have him cycle for 3 minutes with a 1.0 kilograms of resistance. After the 3 minutes, we'll check his heart rate and blood pressure. And then, after that, we'll increase the resistance to 1.5 kilograms of resistance, and he'll cycle for that for 3 minutes. After 3 minutes, we'll check his heart rate and blood pressure.
Okay, so it's almost 3 minutes now. We're going to start to do the heart rate around 3, and then we'll tell him to stop pedaling at 3 minutes so that I can do the blood pressure, alright? Yeah. 10 seconds left. At 3 minutes past, you're going to stop. You get the heart rate.
Okay, I want to try something.
Seconds. Done.
Yeah.
What is it? It's 14. 14 and 15 seconds. 14 and 15 seconds. Okay, so heart rate is going to be 14 beats in 15 seconds, so you times it by 4. 60. So 60 beats per minute right now. I'm going to do blood pressure right now. So 138.
Look, you could easily just use Google or something,
Okay.
put some stuff on it, put the camera there.
Like, freak out for a second. Yeah. I think it's just the harder stuff. Okay.
138 over 80. I almost dragged you with me.
That's what it sounded like.
And it was 60 beats per minute.
That's what it sounded for, like a...
Alright, so now he's going to pedal again. This time we're going to increase it to 1.5 kilogram. Alright, go ahead and start pedaling.
Okay, yeah.
And we're going to do this again for 3 minutes. Alright? Alright, so we're about 3 minute mark again with the 1.5 resistance on him. So we're approximately about 20 seconds left of it. After the 20 seconds, we're going to do the same thing, heart rate as well as the blood pressure on him as well. 10, 5, 4, 3, 2, and 1. Alright, you stop.
So it's 60 beats per minute.
60 beats per minute, okay? And I'm gonna do the blood pressure now on him. 140 over 70. Alright, so you can step off the cycle and you just take a seat over here. And now we're going to do it for 5 minutes resting. He's going to rest for 5 minutes. After 5 minutes, again, we do the heart rate as well as the blood pressure, okay? Alright, so the 5 minutes almost up. We're getting ready to do our heart rate as well as resting blood pressure. Get ready to do that. 20 seconds remaining.
So you got what's it?
So, oh, it's underneath. Okay, it's that. Just tell what 30 for 30 seconds.
So the thing that I signed up for, so I don't have to come on the Friday with them. I just go.
So the heart rate is 60 beats per minute.
120.
Because if it's early enough, I can do it. And then I'll class until later. I think I saw that one. It's like the early one. Yeah, okay.
120 over 80.
80 and 60.
Maintain everything. Okay. We're good to go.
So here are the results for the participant. During his resting, heart rate was about 54 beats per minute. His resting blood pressure during phase 1 systolic was 130 millimeters of mercury. Diastolic phase 4 was approximately about 85 millimeters per mercury. And the phase 5 diastolic was 80 millimeters per mercury, which is a little high, but it's normal. 3 minutes in the cycle with 1 kilogram of resistance. Heart rate went up to about 60 beats per minute, with blood pressure systolic phase 1 138 millimeters of mercury. Diastolic phase 4 approximately about 85 millimeters per mercury, and a diastolic phase 5 80 millimeters per mercury. And when we increase the weight resistance to 1.5 kilograms any cycle for 3 minutes, his heart rate stayed about the same, 60 beats per minute. Systolic phase 1 was 140 millimeters per mercury. Diastolic phase 4 was 82 millimeters per mercury. Diastolic phase 5 was 70 millimeters of mercury. And then we had him rest for 5 minutes. After 5 minutes, his heart rate stayed the same, 60 beats per minute, but his blood pressure actually went to normal with a systolic of 120 millimeters mercury. Diastolic phase 4 was about 85 again millimeters of mercury, and diastolic phase 5 was 80 millimeters of mercury. So what does the data tell us? Well, Justin, our participant, has normal HR and blood pressure. Even during his cycle and after the cycle, he still had normal blood pressure and heart rate. The participant does not have any hypertension and hemodynamics, so which means that he had no exercise limit due to his heart rate and blood pressure. And it also shows that Justin is very physically active as well. As you can tell, after a 5-minute rest, his blood pressure dropped right back down to normal basically.